Well, thanks, Dr. Ryan. And then we have Dr. Rikki Priest, who works at the King Edward Memorial Hospital, the Coburn Medical Centre, and does research for the University of Notre Dame. And I think it's a review of a book. No?
I haven't read it yet.
Well, it's To Light the Stigma on the Fire and Watch It Burn, One Doctor's Journey with Mental Illness. Maybe you can explain.
I'll try and explain in 12 minutes. It was late on Friday night, the 24th of February 2017. We'd welcomed our baby girl into the world 11 days earlier. I hadn't slept in 3 days. I didn't feel right. My thoughts were very, very busy, and I was trying to figure out what seemed like an unsolvable problem. Was I well or was I unwell? My husband and my mum were fighting about that same question at the time. My hubby didn't want to consider the possibility that I might be mentally ill, but my mum could recognise the signs. She'd seen them many times before in my brother and my father. They'd both had type 1 bipolar, coloured by psychosis, delusions and mania. That night, a colleague who I didn't know very well phoned me to have one of those "are you okay" conversations. She said she'd noticed a few things that were out of character. I was posting a lot on social media and my spelling was uncharacteristically terrible. I told her everything, and she suggested that I head into the assessment unit at the maternity hospital where I'd been working only a few weeks before as an obs and gynae registrar. I agreed to go in, mostly because I was terrified that my husband might be killed around heavy machinery the next day because of fatigue, and I thought a night in hospital where we could both get a good night's sleep and the midwives could have our baby girl sounded okay. I got an hour's sleep, and I woke up feeling like I could run a marathon. And I hate running so passionately. I knew that wasn't right, and I agreed to see the psychiatrist the next day. I had a long 1-month voluntary admission to the mother-baby unit, and then we were finally home. I relapsed 1 week later after making quite the organised plan to end my distress and make life a bit easier for those around me. So I was back in for a few more weeks. It was the most challenging experience of my life. I was used to being able to trust my mind. I had duxed every year in high school. I was chair of junior doctor committees. I was collecting postgraduate diplomas. I was teaching medical students. I was doing research. I was getting nominations for the Junior Doctor of the Year award. I was winning prizes in academia. My self-worth was tangled in achievement like a pair of headphone cords. To quote Louisa from the movie Encanto, "I'm pretty sure I'm worthless if I can't be of service," was my motto. Maybe I was compensating for being the broke girl from the broken home on a compassionate scholarship in a private school. I was used to trusting my mind, like a solid platform below me, and then I got sick, and that glass platform shattered. I was free-falling, and my mind was chaos. So what did I learn? This is just a snippet. There was lots more. But doctors don't get to skip the healing part. I think many of us think that high-functioning doctors with mental illness have a much more rapid recovery trajectory and can bounce back to wellness just as quickly as it comes on. A bit like a patient with low blood sugar bouncing back when they've had some jelly beans. But it's much more like a grand mal seizure, postictal confusion, and a gradual return to function. I had to be the patient. It took time to process the trauma. When I went back to work, I faced seeing the nurses and psychiatrists in the corridors who months earlier had seen me at my lowest points. They had helped me to plan a realistic day, reminded me to eat, reminded me to feed my baby. I'd see them and I would be catapulted back in time and get the dreaded frog in my throat and the heavy chest and seek escape. Over time, things got better. I was able to work, returned to doing surgery and night shifts, completed my advanced transcog and was doing all of the things. and I can now share a smile of acknowledgement and gratitude as I pass those who are involved in my care in the corridors. It's a new normal. But I did try to skip things along just a little bit, tried to jump the queue of wellness. After I got sick the first time, I thought, if only I had a hobby or an interest outside of medicine, something that was just for me, for enjoyment, then I could fix this, I could beat this. And I'm wondering if that might sound familiar to anyone else here. I did gardening, painting, cooking, clay moulding, cello lessons, took up Indonesian again. I could beat this. And this illusion of mine inspired a little video production. It's still up on DHASWA website. The core message was doctors need doctors too, which is true. And we had a montage of doctors doing activities outside of medicine, cooking, playing with their kids, painting, music. But doing is often not the answer. Surrender, time, and support are more helpful allies. So how are things now? I take my medications, I see my psychiatrist every 3 months, some psychology, and I'm enjoying good health. And every day there is a mosquito in my room at night. Most of the time I don't hear or notice it. Other times it gets louder, and I know I need to slow things down, get a little more sleep, and get a little less busy. Because for me, if the mosquito of my mental illness bites, our world and the world of my family falls apart for a while. And I can't hobby or side interest my way out of that. I can't capacity build my way out of that. I can only surrender and be deeply and wholeheartedly grateful for the gift of insight and early intervention. I had a prophylactic admission after our son was born, which wasn't easy, but was a lot smoother than the first time. It's my 30th birthday as an inpatient. There are unique challenges for doctor patients. Either we don't ask for help or we demand help. And we tend to fall on one end of the spectrum. The first doctor wants answers now, doesn't want to be on a wait list, wants special favours, wants to see the treating team with updates daily, wants copies, and sends an email asking for their script repeats. You probably know the type, often fueled by anxiety and a lack of control. The second doctor is apologetic for everything, floppy and spineless like overcooked capsicum. Understands that the team are busy, happy to wait another day without review, hates asking for help. I do not like asking for help or advocating for myself, and it could have cost me my life. Fast forward 2 years, I was doing a cesarean list one day, feeling like my normal self, and the next day was a rostered day off, and something happened, which was a catapult trigger back to some childhood trauma, and then I wasn't okay. I didn't want to die, but a new truth was forming in my mind that the only way out of a situation was if I took my own life. I had the insight to know that truth wasn't what I really wanted, but the terror grew as that idea took over like the tightening grip of a python. So after a call to DHASWA, the Doctors' Health Advisory Service of WA, and not being able to get into my GP, a psychologist, a psychiatrist, I took myself into ED. Another long admission, but the healing journey was a more familiar one this time. One night, during this third admission, I really embodied those floppy, overcooked capsicum vibes. I was feeling more and more unwell and being told by nursing staff to go to my room, go to sleep, you're being anxious, we're not going to call the doctor, we can handle this. But I didn't feel anxious, I felt sick, really sick, and I was calm. I phoned my midwifery bestie and I told her that I thought I was going to die that night, and I wanted to tell her so that she would know the whole story. Death seemed like an easier outcome than demanding help or upsetting someone. I went to collect my morning medication the next day. I must have looked like death. They hustled me into a side room, took my obs, and called a Cat 1 ambulance. I had Stevens-Johnson syndrome, a life-threatening drug reaction with scarily high mortality. Corridor conversations with 3 familiar colleagues working in the ED before I even got to my cubicle trying to come up with the words to explain the journey and the distress that had led to this moment to being an ED. I had learned how to be a doctor patient with mental illness, and it was here on the 7th floor of a general hospital that I learnt to be a doctor with physical illness. I learned what it is like to be trapped in a liminal space, not knowing the length of stay, knowing the importance of sleep for my mental health while being woken overnight for nursing checks, medications, a beeping fluid machine. The challenge of our little ones seeing me sick and trying to find honest words that wouldn't scare them. The relief of a kind nurse, the feeling of sunshine on my face after 3 days inside. The mixed feelings about the derm reg being a peer from my AMA Doctors in Training days. I did get better, physically and mentally. And now it's my GP, my hero, who coordinates the health of our family. One thing I really value about my GP is that I feel safe in the boundaries and the roles that are clear that have been set up in our therapeutic relationship. I'm a GP registrar and she treats me like a normal patient. Still explains things in basic terms. She's brilliant. And I'm curious, and I wonder how you would go if you needed help and inconvenienced someone else to get it. Lastly, meaning making and stigma. A really important part of healing from trauma is making meaning from it. In technical terms, post-traumatic growth theory, to find purpose beyond pain. I have found some purpose beyond pain by sharing my story and the lessons that it has taught me, both in private conversations and more public snippets in association with two wonderful organisations, PANDA, Perinatal Anxiety and Depression Australia, and DHASWA, the Doctors' Health Advisory Service of WA. One day, if not already, you'll be wounded outside of medicine or because of your work in medicine. How you surrender and heal from it is everything. If you embrace the humanity of medicine, your story could be your unique gift to others. Mental illness has been the most challenging thing I have ever gone through. And while I regret the pain of my friends and my family, I'm now grateful that this is a part of my story because I've been able to make meaning from it and help others in ways that would not have been possible without having been through that experience. I think that sometimes there are diamonds to be found when we hit rock bottom, even if we don't realise it at the time. The most important takeaway that I want to share with you today is that the story that you tell yourself about your own mental health or distress or burnout or grief, it matters. And it matters a lot, and it impacts how you perceive others. I've had to own my story and completely detach from the narrative that involves stigma. We all have to, if we want to help people step out of the boxes of shame or stigma that we put ourselves in or that we let other people put us in. If you are less likely to seek help for yourself, or if you see your own mental illness as a weakness, research consistently shows that you are statistically more likely to judge others and to agree with stigmatising statements such as, doctors with mental illness are perceived as less competent, achieve less, should be able to avoid becoming depressed, are less reliable, or are less likely to progress in their career. These are part of an unhelpful narrative, so please check your own stigma and leave it at the door, or better yet, light the stigma on fire and watch it burn.
Well, thank you, Rikki. I wasn't aware that you'd be deliver something so meaningful and personal and poetical at the same time, and so thank you.